thankful to have you join us for the National Community Health Center Week, where we always try to have a day set aside to recognize our legislators and local officials and congressmen for their support that they have given to Albany area primary health care over the years. And we're so thankful to have you participating in our meeting this morning. I think we may give it just a few more minutes. If you'll hold tight, we'll probably wait another 2 minutes or so, see if we can get everyone else logged on, and we'll go from here. All right, we'll give it just one more minute. We still have some people logging in. All right, we'll go ahead and get started so we can be respectful of your time. And again, thank you for joining us on this Friday morning to help us recognize our legislators, local officials, and congressmen that support us and are always our cheerleaders in the background so that we can continue to do the great work that we do. I'm Shelley Spires. I'm your CEO for Albany Area Primary Health Care, and welcome you to this webinar this morning. Next slide. So, National Community Health Center Week. This is the time of every year, the same week every year, that we take an opportunity to try to point out everyone that supports us in so many ways. We've had so many activities and events this week. We've actually had an opportunity to appreciate our staff. So we have had Staff Appreciation Day. One of besides the staff, the most important group is our patients, and then of course celebrating our services. Yesterday we had a wonderful fill the bus school supply drive where we had people drive by and pack our mobile unit full of school supplies so we can share them with our school-based health centers and pass them out with our wonderful patients/children in our schools that we get to serve throughout the school year. And then today, you can see we set aside time to actually recognize again just the support that we receive from our legislators, our local officials again, and congressmen. Just a shout out, we are having a lemonade stand fundraiser today here at 2408 Westgate. So if you're out and about, we'd love to have you stop by, purchase some lemonade, make a donation, have a friendly conversation. We'll have some staff out. We're very excited about it. And this is also to provide support to our school-based health centers. And we look forward to maybe having you come by and grab some lemonade. So those are that's our week events. We're at the tail end, as you can see, but it's always a wonderful opportunity to really highlight the good work that everyone does in this organization, outside the organization, and to let our patients know how much we appreciate them. Next slide. So, for some that may not be completely clear on community health centers and their roles in the communities, just to give you a highlight, there's 1,400 community, or sorry, 1,500 community health centers across 16,000 locations. Over across the United States. And with that, we actually increased the people we serve from last year to this year by 1 million. So we are up to 32.5 million people that we serve. And just to give you a little breakdown, that consists of veterans, children, homeless, and seniors. So, when you look at those numbers, they're pretty impactful numbers and really signifies the good work that community health centers do. 40% of us community health centers are in rural communities where your nearest access to care might be 40 miles away, 50 miles away. And that could certainly mean life or death for some people, especially if you've got severe asthmatic. So we are certainly glad that we can fill that gap and be in areas that we can feel that we are a safety net to our communities. 1 in 10 Americans are health center patients. So 18% of them are uninsured and 50% are insured by Medicaid. And so while we serve everyone, we always like to point out again, just the safety net that community health centers, their role that they play as a safety net provider to our rural areas. Next slide. APHC provider. So we talked, nationally. Let's kind of break it down so that you can see what your efforts and support, where they go, and how many people we serve because of you. AAPHC providers cared for over 54,000 patients, and we had 217,000 visits last year. So we're not a little small mom pop shop. We actually are pretty large when you look at these numbers. We employ over 400 employees, and we have 90 providers serving in Southwest Georgia. And again, I always like to highlight the providers because those are 90 providers that truly have a passion for what we do and really buy into our mission. We're one of the largest groups in Southwest Georgia. We provide health care to residents across 11 counties. And of course, we have a large number of clinical sites. So we have over 30 clinical sites, 2 pharmacies, and then 1 administrative location. Next slide. So, as we really talk about rural communities, one of the things that has been emphasized over the past couple of months, but throughout our inception for community health centers, is medical deserts. And again, where do we play a role in filling those gaps to ensure that these communities have health care or access to health care? And just to define that a little bit for you, it's where a region where residents have limited access to services. It could be closing of medical facilities. Some may know I was an employee of a critical access hospital that unfortunately closed in a small rural area. A shortage of healthcare professionals could actually be in this definition as well. And then long travel distances to care or high cost. These are really areas or things to think about when you're wondering, well, is my community a medical desert, or is my relatives or friends? So this will kind of give you an idea. The lack of access can lead to unmet healthcare needs and poor health outcomes. And so a lot of times, if in these rural areas, if you don't have access to healthcare, the illnesses or the chronic illnesses could exacerbate into something more, which could create poor health outcomes when if they had access and ongoing preventive care or maintenance care, they might be in a better situation as it relates to their health. The numbers are kind of striking. So 80% of rural America is considered medically underserved, which is quite interesting. And then 10% of rural hospitals have shut down. As I said, it's been many years ago. Mine was actually back in 2001 that the critical access hospital I worked for had to shut down due to financial sustainability. 66% of primary care shortage areas are located in rural communities. So again, just, being mindful of some of the statistics and the definitions of where some of these pain points, if you will, are located so that we can continue to work to try to mitigate some of these issues to access for care. A majority of rural areas in the United States are effectively becoming or already are medical deserts. And then Southwest Georgia, of course, is not immune to this crisis. And again, one of the things we continue to do is to look at the needs of our communities, the lack of access in whatever area, whether it be maternal health, behavioral health, primary care, really being mindful of what are the needs and how can Albany area primary health care go in and actually provide some sort of care to these individuals that don't have access. Next slide. Community health centers are just one way we can combat medical deserts in our hometowns. Again, just really providing an opportunity for everyone, no matter geographical, no matter about their economic status, where they can still have access to care. So that we can continue to help provide preventive medicine, chronic maintenance meds, and again, try to figure out how do we get them what they need. So one of my phrases, and I use this quite often, is where there's a will, there's a way. And so I always try to figure out what are the patients wanting, and then how can we get them what they need. Next slide. We've talked a little bit about what these deserts and what community health centers' roles are and how do we fill those gaps. And again, as explained earlier, just really paying attention and being very conscientious to the areas around us, especially rural areas that have access to not just preventive care, but specialty care. And how do we bring that to them? And so your support for community health centers has allowed for us to strategize and implement ways to provide that care and fill that gap for some of those needed services. Albany area primary health care is in underserved communities to do exactly what we are made to do and support our mission, which is to provide quality health care to everyone. We see physician offices and hospitals closing, but community health centers remain strong and ready to serve our members. We care for, as we said, everyone, but we absolutely make sure we take care of the insured, uninsured, underinsured, and self-pay patients. Our doors are always open across our 11 counties in Southwest Georgia. So again, just to reiterate, we take our services to the patients. We try to make sure they have what they need so that they can live healthy lives. Next slide. Let's talk a little bit about how we get providers to these rural areas. We had a wonderful time this past week up in DC with a lot of National Health Service Corps recipients. We had an opportunity to educate and share with individuals about the program. And this is really one of the programs that is beneficial to not just community health centers, but rural health centers also benefit from this. But this is a piece that actually helps support bringing providers to rural areas. And so what this is, it's a federal program that supports the recruitment and retention of healthcare providers in underserved areas. There's so many programs that fall under this umbrella, but the two that we really talk about is scholarships and loan repayment. And what it does is it places primary care, dental, behavioral health professionals in shortage areas, which equates to your rural areas. And the goal is to expand access to quality care and, of course, reduce healthcare disparities and have better outcomes. And this is one of the programs that actually help us do that. This is a very exciting program because this is how we recruit a lot of our providers. And quite honestly, this is for those who might be aware of Jim Hotz. This is a program in its beginning infant stage as to how we got Dr. Hotz here, who is still with us today. The physician that came after him, Dr. Scoggins, still with us today. I think he is about to retire, but he has served his entire career here and certainly been beneficial to this organization. And we can just keep naming after every, on down. So this is really one of those programs that people um, they actually sign up for, and majority of the time they end up staying in your communities, and especially here at Albany Area Primary Healthcare. I'd like to say it's probably because of administration, but I think mainly it's because of the communities that they work in and their patients that they love. So very excited. The continued support there is very important so that we have these providers come into our rural areas to serve our communities. One thing I'll add that's not mentioned here is the state of Georgia also has some opportunities for loan repayment in rural areas also. And so we do take advantage of those as well. And we've had people who have had an opportunity, again, to receive those perks for being in rural areas. Next slide. So a lot of times, there's two hot topics right now that we hear a lot about. One is behavioral health, and one is maternal health. And one of the things that we are a safety net for here in our Southwest Georgia area is OB. We are very fortunate to have a group of clinicians, physicians, staff that really pour into our maternal health program. We're actively addressing the growing deserts across Southwest Georgia around maternal health. We have OBGYNs retiring, we have offices closing, downsizing, and so we're really trying to step up and be that partner for the community so that we can continue to see our patients. We're committed to continuous recruiting of OBGYNs. Fortunately, which is a great thing, is this is a discipline that falls under the National Health Service Corps. So this too helps bring people to Albany area and our surrounding areas. We know that a growing community relies on strong OBGYN programs. It helps attract young families, new professionals. And we want to make sure we can continue to be able to provide that service so our areas will continue to grow. Next slide. One of the things that we always like to update our officials on is our services. They continue to grow, which is a good thing because we pride ourselves in being able to offer things to our patients that they might not be able to access otherwise. So we have a list of our services there for you to take a look at and just kind of refresh your memory on what we have available. But one of the things I'll point out that's kind of a new endeavor for us is we actually have opted into um, working with uh, big businesses, as you can see Procter and Gamble there. And one of the things we're trying to do is to help create a healthy environment for employees by partnering with some of these organizations. And so we had the pleasure of building that relationship with Procter and Gamble. We have an on-site doctor's office there. We have a provider there that sees the employees, as well as I think in the future we're getting ready to expand that to some of their contract employees, but really trying to figure out help keep their healthcare costs down and have readily accessibility for their patient or their employees when they need it. Next slide. So community health centers, as I have discussed earlier in this presentation, and will continue throughout, to highlight just the how valuable we are in the communities. I think you know that because again, we get extreme support from national to state to local, and we're very thankful. But just to continue to refresh, bring that back to the top of your thought process that we are considered a very valuable piece to the community. We're efficient, we're affordable, we're accessible, Our goal is quality health care for everyone and continue to help fill those gaps to reduce healthcare or health disparities. Recruiting providers to our areas that we may be lacking. And again, saving lives in our rural communities because without some of these clinicians and the support staff in these rural areas, um, who knows what the community might have to go through. And so, very excited that we can be a part of that. Next slide. So we'll get into something other than me just talking and telling you how great our organization is and how wonderful our providers and staff are. We're going to talk a little bit about behind the scenes at our community health center and hear a story. We have a little short video for you on the next slide. We continue to do great work, as you can see, and hopefully, a lot of what I've already explained to you was reiterated in that video. Not scripted as far as how it was repetitive, but certainly just to continue to share the stories and the mission. So with that, I would like to introduce Miss Phyllis Colvin. She's our regional director, who oversees our Lee Health Center in Lee County, as well as one of our smaller rural areas in Dooley, the Charland Trussell Community Health Center. And I'll turn it over to Miss Phyllis to really expand and educate on Lee Health Center and the services they have.
Good morning, and thank you, Ms. Shelley, for the opportunity to talk about what we call our one-stop shop at Lee Health Center. About 2 years ago, AAPHC decided to develop what we would call a one-stop shop. We also talked with our patients to see if the need was truly great here in this area. Not only do we have a one-stop shop here at Lee Health Center, we also have one that's located in Dawson, Georgia, Dawson Medical Center. The services that are provided here at our facilities are, of course, our primary health care services. We have vision, dental, podiatry, and behavioral health services. Within our vision department here, we now have an ophthalmologist who has been collaborating with our local hospital by doing surgeries, and he's also doing in-house laser surgeries as well. Lastly, to mention here at Lee Health Center, we also have one of the pharmacies here. And it's wonderful that patients can come, they can see their primary health care provider, they can see the behavioral therapist and the dentist all in one day, and they can leave with their medications. It's a wonderful thing because it also decreases the amount of no-show appointments that a patient may have. They don't have to take off from work multiple days. If one of our providers has a patient that needs to see one of our specialists, they just walk across the hall and talk with that provider and ask them to add them to their schedule, and they gladly do so. So it's a wonderful thing here to have all of the services in one area. And again, thank you so much, Ms. Shelley, for allowing me to speak about what we call the one-stop shop here at Lee Health Center and at Dawson Medical Center. Thank you.
Thank you, Miss Phyllis. That's very impressive that we can get all of our services in one area. Can you tell us a little more about Lee Health Center and how the model benefits patients as far as having these services? We talked about being able to get an appointment right away, but how is it related when you talk about the continuity of care and having these services available?
So it's such a wonderful thing. Like I said, it's just when a patient is seeing their primary care provider, and the primary care provider notices that there's something going on with a person's foot. They have a wound that just is not healing. That they can talk with the podiatrist here, which is Dr. Felton, to see if he can see that patient on the same day to go ahead and get those services provided to them. Or when a patient has something in their eye, they'll walk across the hall and speak with our vision doctor and get them worked in that same day. It's not a, well, we'll call you in 2 days and get you scheduled. No, it's a right now appointment. And we try our best to make sure that our patients feel comfortable and knowing that we're going to get you in and we're going to get you in today. And I think that's the best thing that we can offer now and that we do offer here at Albany Primary Healthcare is that we're able to do those same day appointments that patients don't have to wait. And one thing that I know parents are happy of is that they can bring their little child to see the pediatrician and see the dentist all in one day.
It's awesome. And Miss Phyllis, I'm going to add to right here. It looks like in this picture you have a drive-through. What is that? What is that drive-through?
That is our pharmacy, and they are open here Monday through Friday, 8 to 5:30. And they provide wonderful services. They work in conjunction with our providers when patients have questions about their medicines or when they have questions about their medicines. Instead of putting a call in to a pharmacy, they just walk down the hall and go speak with the provider, talk with them about the patient's medications, get the questions answered, and provide the answers to the patients. Our pharmacists and our pharmacy services are very wonderful to our patients. They do deliveries timely. Patients call and their medications are delivered the next day.
It's awesome. That's all. It sounds like it expedites the process for me being able to get my medications timely.
It
Thank you.
does.
Thank you, Miss Phyllis. You have a wonderful facility and good luck on all those services that you're trying to provide there as a one-stop shop. So excited about Lee Health Center.
Thank you, Michelle.
So we'll move on. Our next highlight is our school-based health centers, and we have Miss Bibi Hale, who is our patient navigator. Um, Miss Beebe is not only our patient navigator, she was actually our Employee of the Year. So we're very excited about the outreach and marketing and communication and education. She is everywhere with this big blue bus. She does a lot with health center or school-based health centers, but you'll see Miss Beebe involved actively in other things, even outside school-based. So, but Miss Beebe, today I'm gonna let you give us a little more information on school-based health centers.
Good morning. Thank you. Yeah, we know that school-based health centers provide medical, dental, vision, behavioral health. Some of the things that we don't realize, we provide assistance with utilities, rent, clothing, and food. We also, with the mobile unit, are able to go to Worth County, Baker County, and see those students as well. We have a wonderful team of providers and staff that are in to win. We are opening 3 new school-based centers here in Dougherty County and 1 in Randolph County this year. So we're real excited about that. We've been able to go in, do open houses, educate the faculty and staff, along with the parents. And we have had nothing but great raves, reviews. We're looking forward to the 25-26 school year.
So, thank you, Miss BB. So, there's a lot of good things happening within the school-based health centers. Can you share more about this program? Like, if I have a child at one school and they need vision services, but I'm at Turner Elementary and the vision clinic is at Alice Coachman, how is that partnership with the school system?
So we partner with the Dougherty County School System. They provide busing for us. So we have, each school is assigned what I call a home base. Our vision center is in our Alice Coachman School. Our dental for the majority of the Dougherty County School System is at Albany Middle. And then we have a dental clinic at Turner Elementary that the Turner students um, see the dentist there.
And if I have a child at like Sumter County, do you take the mobile unit there to provide some of those specialty services?
We actually have a clinic there, but yes, there has been Special Olympic physicals that needed to be done. And because we have the handicap access on our mobile unit, we will take the blue bus right on over there.
Well, thank you, Miss BB, for that wonderful education on our school-based health centers and all the wonderful things you're doing to make sure our kiddos get seen.
Thank
I want to
you.
just do a big shout out. Next slide, we'll do a big shout out, of course, to Miss Phyllis and Miss BB for all of their wonderful hard work and continue to spread the word. So, again, we are the best kept secret, not intentionally. We really want to get the word out of everything that we do. So continue to share that amongst your friends, families, and communities because we truly are a hidden gem. And chances are we're right there. We're your neighbor in your own community. The next slide, we'll do a small video, actually a trailer. Some of you may have heard about the wonderful short film, I think's how it's titled, Doc Albany. It was selected as the focus of a short film by two-time Oscar-winning director Ben Proudfoot. The 17-minute film highlights much of what we've discussed, community health centers, National Service Corps, medical deserts, etc. It focuses on the story of AAPHC's Dr. Sheena Favors, and Dr. James Hotz. Jim Hotz, as some probably know him. And really, it takes us from the early years of Albany area primary health care, and like I said, the infancy of the National Service Corps to where we are today. Unfortunately, there will be more to come as far as the whole film because it's 17 minutes, but we did want to share the trailer. But the trailer really does not do the entire film justice. I have the pleasure of just last week seeing the entire 17-minute documentary myself. I had not seen it prior to that. Um, and in a room full of National Health Service Corps physicians, clinicians, past recipients, the people who really understand what it means to serve in underserved areas, rural areas, and their role for these patients, community members in these areas, and how huge that really is. So, looking forward to being able to share this at some point in time in the near future, the whole 17-minute film. So, stay tuned. But just know it has a lot to highlight, not just about Albany, Georgia, but just about the community health center's role again, and just providing that safety net for our patients. So we're proud to announce Doc Albany was selected for the Tribeca Film Festival. It had its world premiere in June of 25. 90 films, less than 90 films, were selected. There was over 10,000 submissions, and we were chosen as one of them. So we have future plans for a local premiere soon, and again, we'll make sure that everyone gets invitation to that premiere. Next slide. Why this approach? It brings about the compassion, the human look at community health centers. You sometimes can't put into words what the work that we all do and the impact it has, not just on the communities, because that's that's the importance, that's the number one thing, but for us as individuals, it fulfills a spot where we're able to give back and make a difference in health disparities. Next slide. So we need your help. We need you to continue to support us, continue to be our cheerleaders, continue to educate your local officials, your state officials, and from the national level, just how important we are in the areas that we serve, and the drive that we have to make sure that our patients have access to care, our communities have access to care. Next slide. So what do we do now? What are our needs now and beyond? Continue the bipartisan support. That's one of the beautiful things about this program is we have strong bipartisan support both across both sides of the aisle, and that's such a wonderful place to be, that both sides understand and believe and support what we do. Increase long-term federal funding. Again, as I said earlier, we operate very efficiently and we still provide quality care. We have the data to back all of it, to prove what we're doing in these areas. And that continued funding and increased funding will just allow us to do more in these rural areas, to bring more specialty care to some of these patients in rural areas that don't have access for whatever reason, no transportation, homebound, whatever the case may be, we would be able to do more. Development of new providers and nurses to combat shortage areas. The National Health Service Corps is huge. The continued funding and increased funding for this is, there's no words as to what this could do for more people in our areas, just the clinicians who have the compassion and the drive to do this, to be able to continue to do the things they love. And again, like I said, at the end of the day, we do the work in the community so that we can take care of the patients, but we take home so much more. We are full, our hearts are full when we take home these, wonderful memories of taking care of our patients. Protect 340B programs. Ms. Phyllis enlightened us about the importance of our pharmacy. how wonderful this program is to our patients. It actually also is a benefit to the organization. This is one of the things that you all have supported in the past. And as the way the program stands today, it allows us to put services back in. So we're able to enhance our behavioral health services for our patients so that they not only get therapy, but they can get psychological testing. They can get med management. These are things that we cycle back into services for our patients. We talk about OB. Um, and again, these are just service lines that are a little more expensive than primary care just because of the expertise and specialty it takes in, certain areas. And that program really helps support this. So if, we could give a shout out to continue to help protect this program, and just continue to strengthen it so that community health centers can continue to expand what they do to these rural areas. Support telehealth growth. This is one of those things that has been truly amazing for our patients. There's still some barriers to broadband, which I know as a state we're working on, but there are still, unfortunately, patients who do not have access to internet. And so we want to continue to work on that and continue to understand the importance of telehealth. This has been very instrumental in our behavioral health setting, where patients have been able to continue therapy because if you're not aware, we have patients driving 3 hours for therapeutic service or behavioral health services. And it's nice when we can say, let us just do telemedicine this time. We'll see you in person next time, just to keep those down. But that 3 hour drive is just a testament to the shortage of providers for behavioral health and the need. Ongoing support of rural communities, community health centers, and the fight to combat medical deserts. Again, I can't emphasize more the importance of all these programs that you all continue to support us in and continue to stand behind us, but we can't let anything happen to any of these programs as it relates to either eliminating or decreasing. Would love to continue to increase the funding and then the support for this, understanding the situation and climate that we may be in today as we look at so many avenues of other people and funding or organizations and funding, but just to keep in mind how important it is to continue this safety net for our communities. Next slide. Again, if we work together, the future is bright. And as I always say, where there's a will, there's a way. And barriers will always present themselves. But I think one thing I can say about community health centers is we will continue to fight for our patients. The providers will continue to find ways to provide the needed care to our patients. We will also work to make sure they have access to the services that they need. And we will continue to fight this fight together. Next slide. All right, so just a big plug again for our wonderful lemonade stand today. So if you're in the area, or if not, you just want to send a donation, we'll gladly accept that also. But Friday, today, August 8th, 2:30 to 5:30, all proceeds are going to our school-based health centers and local students. And, these are students that, have needs. We give socks, we give clothes, we give jackets, we give shoes, we give school supplies, pens, paper, just the students who actually come back and don't have the means to do the work that needs to be done in the school setting. We try to make sure they have that. Plus, they feel good about it when they have it. So we're hoping that we'll see a lot of people come by, take advantage of our lemonade, and support our local school-based health centers and our students. And next we have questions and answers. So I'll be more than glad to take a stab at some questions if anyone has any. Okay. All right. So as always, we love to give people back some of their time. Oh, I have one. All right. So our question is, what is our biggest workforce challenge? Our biggest challenge is, as far as disciplines go with clinicians, the recruitment of our behavioral health clinicians, our psychologists, is probably one of our most challenging. And then, bringing people to rural areas is not always, we can't sell rural areas as we sell Atlanta, but we can sell rural areas as a close, um, family atmosphere. And what's interesting is we'll have people who may not have been interested in Albany, Georgia, or our surrounding areas. And when we bring them down for a site visit, they quickly change their mind about a small area and what it means to get from one side of town to the other side of town in just a few minutes. But nevertheless, the recruitment challenges around workforce is it's the clinicians, of course, but we continue to try to foster or try to look for ways to foster our clinical support staff and again, work on medical assistants and LPNs and how do we grow that workforce so that we continue to have the support that we need from the clinician standpoint and their support from their support staff standpoint. Any other questions? All right. Again, thank you so much. I look forward to this every year. It gives me an opportunity to really share with you the things that we've done, the things that we continue to do, and the things that we hope to do in the future. And again, don't hesitate to reach out if you have questions or if there's something you would like to know around data or impact or outcomes. We will certainly be more than glad to share that with you. And I am giving you back almost 15 minutes of your hour. So I hope you have a wonderful day, a great weekend. If you're in the area, come by, grab a glass of lemonade. If you're not, we will be more than glad to accept a donation. And you can just make it payable to Albany Area Primary Health Care, and we will ensure that it goes to our school based health centers. Thank you very much and have a good weekend.